Namaste. Did you know that the same patient going through the same surgery, but if that surgery is performed by different kinds of surgeons, will need a different anesthesia? This is something really interesting to talk about. And we start to get this notion as anesthesiologists only after a few years of observations of working like years and years with the same kinds of surgery performed by different kinds of surgeon. And for me, after studying Ayurveda, this became much more clear because in the beginning I started to focus my attention more on the prakriti of the patient, because I want to understand if knowing the patient's prakriti will help me perform a more adequate anesthesia for this patient. But I started to observe that I need to observe also the prakriti of the surgeon who's going to perform the surgery, because this will change lots of things that I may need in terms of how much anesthetic I will need to alleviate the pain stimulus that will be originated from that movement of that particular surgeon. And we really can see this. And Ayurveda opens more our mind, I think, to these really, really subtle observations. How the different kind of pain stimulus performed by the surgeon will demand a different attention of me as an anesthesiologist. I find this really interesting. For example, a more aggressive surgeon who is less delicate will promote more pain stimulus during the surgery, will require more anesthetics than the more delicate one, or the surgeon who takes a longer time because has more difficulty in making some important decisions during the surgery is also one that I will have to know that instead of surgery that will take an hour, maybe the surgery will take 2 hours, and this will change also. So it's very interesting how Ayurveda makes us realize that we have to understand the whole environment, not only the patient, but the kind of surgery that he or she is going to be put through, and the surgeon that will be performing. Obviously, that the depth of anesthesia, maybe it's a subtle difference. It's not a huge difference. But even though we can, as anesthesiologists, after studying Ayurveda, perform a much more precise anesthesia for our patients when we understand this. So I wanted to bring a little bit about this today. Hope you find it interesting. I'll be talking a little bit more about anesthesia and Ayurveda around here. Namaste.